How to keep feet healthy. Interesting statistic. Our feet take about 5,000 steps a day. That's 2.5 miles a day. Here are some basic care that we want to consider. First, check daily for cuts, sores, swelling, or any infections in the toenails. Give them a good cleaning in warm water. Moisture them every day with lotion, cream. Don't put moisture between their toes. You want to keep the skin as dry as possible to prevent any infections. Avoid wearing tight-fitting shoes. Skip the flip-flops and flats. They don't provide enough arch protection. Trim your toenails straight across with a nail clipper. Then use an emery board or a nail file to soothe the corners. How to take care of foot odor and sweaty feet. You'll want to make sure to clean between the toes. You'll want them to have dry feet and sprinkle some powder. Change their socks frequently and use moisture wicking socks. Corns and calluses. Wear thick socks to protect your skin. Rub your callus with a pumice stone while you're in the bath or the shower. Use corn pads to relieve pressure. If you notice that they are having these issues, always see their doctor. Irritation is the main cause of corns and calluses. So we'll want to, again, make sure to wear shoes that fit them properly. Avoid wearing high heels every day. Use gel pad inserts to further cut down on rubbing or pressure areas in their feet. Diabetes and foot health go hand in hand, so these are some things you'll want to consider. Foot ulcers and infections. Peripheral artery disease, a condition that reduces blood flow to the feet. This happens in people with diabetes. It makes them more likely to get ulcers and infections. Calluses. These are thick areas built up faster and more often in people with diabetes. Therapeutic shoes may be of help. Neuropathy. Diabetes can cause nerve damage in your feet. As a result, you may not be able to feel pain, heat, or cold as well, which means a foot injury can become unnoticed. Skin changes. Nerve control sweat oil glands in your feet, but they no longer work, so your feet can get very dry. They can peel and crack. Make sure you moisturize your feet every day. And avoid getting lotions stuck between your toes. A couple more things about diabetes and foot care. We'll want to make sure that they move more. Exercise improves the circulation of your feet and your legs. Protect their feet from different temperature changes. You'll want to make sure they wear the appropriate shoes for the appropriate weather. Moisturize daily. Treat the tops and bottoms of your feet. Avoid going barefoot. Wear shoes and make sure they fit. Keep the blood pumping. Prop the feet up when sitting and move your ankles around and wiggle your toes. Stop smoking. Smoking can cause arteries to harden faster, which contribute to poor circulation. Fill in the blank. Check, wash, and your feet every day. Thank you for joining Be Amazing, where we understand that it is important to be active, be educated, and be creative.